Hello, I am Jimmy Nyholm, your mental health outreach coordinator for Tri-County CLAD. Welcome to the August 2016 Community Education blog entitled Understanding Mental Health. Welcome this guest, Joel Garcia, for a chat on understanding mental health. Hello, tell us a bit about yourself. Hello, I am Joel, and this is my name side, JL. I grew up here in Oxnard. I'm involved in a variety of organizations in the deaf Latino community. I participate in deaf events and I also teach ASL. Can you share a story about understanding mental health? I really learned a lot through several people who have mental health at different stages. Well, there was depression, getting off the track, mood swings, hyperactivity, weak judgments, weak control of oneself, and so on. I learned a lot about them. I also noticed myself. Do I understand fully? No. I remember that different individuals have their own journey with mental health. Wow, I see their stories with living with mental health. I listen, I acknowledge through their stories. Wow. What symptoms, feelings, did you experience after understanding mental health? I learned a lot from these groups of people, which their mental health identities. Oh, I acknowledge the people instead of ignoring, not recognizing, and judging. And resisting. I am accountable to recognize my ambilism and emotional sense of perfection. Not wanting to neglect and notice these people. The accountability to recognize. I have to learn how to listen and be interactive. Recognize their support, their feelings to express, their experiences, and their struggles. Their journey are important to be acknowledged. Learn to listen, support, talk with them and the deaf mental health community as a whole. Share and work together. What strategies did you utilize in dealing with mental health? Often the challenges were being judgmental, it does not help, and imagining negativity. Thinking that mental health is awful is not helpful. It is important to be accountable and recognize my actions. Remember, each individual has a different journey. With mental health, listen, support, and make sure that the others are okay. Be there. Have a one-on-one with them, depending on their supportive family and community. Recognize their emotional needs, psychological feelings to express. They are important. What we and how we work with them. Listen to their feelings and wants. Fine. If they want to be more than that, there are different professional help. It is important that these agencies and organizations have such services. And it is very important to the professionals who have sign language skills to provide support services on a one-on-one or interactive basis. It always makes sure that you do not neglect the people and provide the interactive support. It is best where there is progress and collaboration together. The deaf mental health community. What is your advice for us as a community? How do we cope with the reality of mental health? I had advice for you, including me, the community as a whole, as partners, to recognize the mental health issues in the deaf community. Speak up and bring out your concerns. It is important to listen and approach the person's needs to find out what he or she needs. That is fine to give them what we have and what we need to do. If you do not have the skills or experience with mental health, there are professionals who do work in the expertise of mental health and provide the tools and resources and the support. And one thing, be accountable to recognize and be aware of the space. Do not take advantage. Recognize and be supportive of the deaf mental health in their community. The barriers, the struggles of navigating in life, they are blocked. Give them support where they can break through the barriers, welcome them, and be partners. Work with the deaf mental health community. It is very significant to give support. Do not ignore. If you do ignore, you fail to take accountability for that support and their accomplishments. Work with them. It is incredible. Thank you. Mental health is compromise of our emotional, psychological, and social well-being. The mental health website, mentalhealth.gov, shows that mental health effects on how we think, feel, act, while also determines how we handle stress, relate to others, and make choices. In every stage of life, from childhood through adulthood, mental health is important. How do you recognize the early warning signs of mental health? According to mental health website, some signs of mental health arise, such as overeating or not eating, pulling away from people and unusual activities, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, feeling unusually confused, forgetful, angry, upset, worried, or scared, yelling or fighting with friends and family, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories you can't get out of your head, thinking of harming yourself or others, the inability to perform daily tasks like taking care of yourself, your kids, or getting to work or school. Mental health website also provides the ways to maintain positive mental health, including getting professional help if you need it, connecting with others, staying positive, getting physically active, helping others, developing coping skills. The Healthy People website, healthypeople.gov, illustrates that mental health plays a major role in people's ability to maintain good physical health. It also adds that mental health illness, such as depression and anxiety, affect people's ability to participate in health-promoting behaviors. Thank you for sharing with us on your experiences in understanding mental health. You're welcome, and thank you.